The A2 segment of PHIG, we were able to initiate the accreditation process. We had several methods of doing that, but one of the things that we found with the accreditation process is that our quality improvement efforts, although they had been ongoing, they really weren't documented properly. And so the accreditation process brought about a better way of documenting and solidifying all of the quality improvement efforts that were going on in the state. We were able to formulate different templates so that other people could use them if they started their quality improvement efforts. We established what we call a culture of quality improvement that was kicked off by our administrator in a large town hall type of a meeting. That was filmed, and that's now used in our onboarding process for new employees so that they understand that we're trying to build a culture of quality improvement. The accreditation process supported all of this, and the documentation that we use has helped many sections initiate their quality improvement efforts, and also using what's called a Plan, Do, Study, Act, and that's if they show improvement, then they continually check it so that they're continually improving their processes. We also used A2 funding to help upskill our staff, and one of the areas that we used that was with Lean Six Sigma certification. We were able to have 14 staff members from administrative assistants all the way up to section managers undergo the Lean Six Sigma training. We also use Lean Six Sigma techniques to improve our contract unit processing, and we were able to bring some contracts that were taking up to a year down to 5 to 6 months. And other contract processes we were able to reduce by 3 to 4 weeks throughout the entire process. And those were very beneficial for us because last year we were able to provide our local health authorities and the city of Carson City and the county health departments their own funding. Well, that process took quite a bit of time to bring the funding actually to the health authorities and to the counties. And that was a delay in services that they could provide. This go-around, after we went through improving the contract unit and reducing the time, was able to bring the funding to the local health authorities, the tribal community, and the cities and counties at a much faster rate so that they can prioritize the needs that their citizens have and using public health funding. The flexible funding that was allocated to the different entities allowed them to do many things. One county, for example, needed access to their citizens in a rather remote area. So they used the funding to purchase a new four-wheel drive vehicle. Other counties were able to use the funding to help with the water quality in an area. Some were able to hire staff to work on public health issues. Larger counties like Southern Nevada Health District in Clark County, Nevada, had a lot of different priorities that they were able to facilitate for their citizens using the state public health funding. In Nevada, if you've gone to one county, you've gone to one county. Every county in Nevada is different. Some of them are very rural or frontier, some of them are very urban. And the flexibility that PHIG was able to do, we had the infrastructure so that when we received other funding, that we could help each of those counties or the cities or the tribal communities use the funding for what they needed in their particular area. So whatever their needs were, they could utilize the funding to benefit their citizens because they knew best how the public health funding would help their citizens of their counties or their city or their tribal community. What we've seen with PHIG in all aspects of it, whether it's data modernization or workforce development or these foundational capabilities, is that it has improved the quality and the efficiency of our state being able to deliver public health programs to our citizens. It has also allowed us to bring in the other health districts so that they can see what types of quality improvement they're capable of doing. If we have ongoing funding, it basically is building the infrastructure of workforce, data, but also quality improvement. And quality improvement is something that most people don't recognize that a state is capable of providing. And it's something that we want to change that model. We want to be able to make sure that people see how quality improvement in state government can help the citizens of the state overall.